Okay, so again, patting under the head, front leg forward, back leg straight, this leg, this arm back. It's only got 2 legs. And so similar to when we're doing things like the elbow and the hip here and this move like that, but what we're doing here is we're locking in here with our arms. We can do it on a smaller person like this. So the hand on the front of the shoulder, hand on the hip, and we can twist. But Ollie's, a bigger guy, so I'm gonna do it more like this, where I lock in like this, and I lock in like this. I get him to breathe. End of the out breath, and you hear those clicks there, right? So it's a...
What's the benefit, Brandon, of trying to do that in one single breath as opposed to take 4 or 5 to inch them?
Either way.
Or like 2 steps forward on one stretch, 1 back in the inhale, 2 forward on the exhale.
As long as it's just quicker, that's all. So we can get on with other things. That would be it. If somebody's the more resistant or tight they are, the more slow you want to go. It's always about that resistance.
So if
never push.
If there were a green light, you can do it 1 step at a time.
That's it.
If there a yellow light,
It's not even necessarily the yellow light, green light, because that to me comes down to attitude. Whereas I can get green light if I'm tight. Like you notice with gas on his 2 sides, it's like one side's going to spasm. So it's not even about attitude, which is the red light or green light. It's more about we haven't worked perhaps the muscles in the feet, or we haven't loosened them up enough at the base. And that's always something to feel for with any joint adjustment, especially that neck. That's why I say they have to give it to you. If not, if you work against somebody who's tightening up against you, you will cause problems. You could spasm their neck. Serious problems. They have to go and relax and go. And sometimes when the rest of the body's tight, they can't do that. Okay? Same here. Okay? So if he was super tight in here, I just wouldn't be able to do it, which is what, when I was working on Yasser, one side he was totally ready to have it, but the other was, it was just like, it's not going to happen. Okay? So again, big breath. Go with the out breath. And at the end of the out breath, we're very near a final adjustment. Okay? So most adjustments are done at the end of the out breath, but during the out breath, we stretch them. So we're not making that full thing, like if here's where you can fully stretch, during the out breath we're reaching there, then we're going a bit further. Don't come from here and go like that. That again can be a bit dangerous, it's too jarring. Do you understand what I'm saying? So we stretch him as he breathes out, that's his maximum, and then a bit more. And that makes the adjustment. Don't come from here and go like that. That's really, that could really sprain or strain a muscle, okay? All adjustments are pretty much like that. Okay. All right. So it's that confidence to get that little bit. How'd that feel?
Fantastic.
Yeah.
You've got more to do?
Yeah, do you want me to show you the back? All right. So again, we can warm up the back a bit. Oh, one went in already. And here what I'm doing is, again, base of my thumb muscle here and the base of the little finger muscle, turning the skin just to create that lock so that we're not all over the place, right? That's how much his skin moves without me taking my hands off his skin. This, less. It still moves a bit, but less. Big breath. And again, not on the spine itself. Okay? And then if he has to take a deep breath in, we can do it in a couple of breaths. But that's how we do that as well. All right? You guys all got moves like this of getting in under the shoulder blade and all that kind of stuff, right? It looks fancier than the value of it, to tell you the truth, but it looks great in a massage video.
Anything else?
The knee area, I mean, like I say, we do things like this where we get in, back in here. It's a nice way to really get in quite deep without a lot of effort. The back of the knee, we don't do much at all.
No, but
The front of the knee, we'll get him to roll over. We're just doing this,
Fucking hell.
yeah. And I'm just letting him have his comments or whatever, you know? If you're having trouble reaching around to get these points, then you can go like this. And you get him to breathe in, into the out breath. And we just gauge just below what he can, before he's gonna tighten up. So this is a very sensitive spot for a lot of people, powerful chi moving spots. And we could work our way up then, and even move it like this. All right? But again, we can even pull the leg out from the hip, and then get our grip better, and then work it like that. Or do what I call the gentle shake, where we just come up and work it up.
You look gentle, Polly.
Did it look gentle?
Anything for like hip flex?
I've got a problem in
Would that
there.
just be the hip one that you used to do where the
He's not listening.
like for like in here
Like in here.
or yeah.
I would mostly just work the whole ankle delta band, because that's where the ankle delta band comes in. So again, if that's tight, it's less of an adjustment or anything than working into here and into here. Spending that, because you can see like with him, he's got these, you know, the bands that are tight in here. So I'd want to get all that out, get this loose, that loose, and then that loose.
Just keep going. What are you doing? It's bad in there.
Yeah, but again, I'm only going to get so much out by working here because he needs a lot more toe work. I mean, you can look at his toes; they're all mangled, right?
Like, come on.
He's a little bit, you know what I mean? Sensitive, should we say. But look, you can see, you know, they're curling. This one's curling under. They're bent, you know, like most people's. They're kind of what I call mangulating, you know. However politically correct we can say it, you know. And this one, but you can see, like, look at this one, it's sort of bent this way. That's creating that tension here. You've got that pulling forward. You know what I mean? So he needs a lot. He's sensitive through all these points here, sensitive in here. And so I would say it's not going to come out like his you know, big toe, like ankle delta tension through his belly is not going to come out here or here. It's going to come out here. Right? And that's going to take time. Even this kind of chest tension up here, I don't know if you can feel that at all through there. But that's all coming from the feet. So, again, I would say,
That's where I was going.
yeah, because you can see that curvature, right? You know, it's still, you know, that's the detail. That's why I'm saying that's where you invest your time. Otherwise, you mess around up here. And you could overdo it up here. Like, say I wanted to get his hip flexor loose and I just rubbed his hip flexor. That's going to cause bad pain after a while. You can sort of sense that, right? You're just going to lock up and go, that fucking hurts. It's not helping.
Yeah.
Because it's not letting go. Even though I'm rubbing it. Same with here. I could just rub that and rub that and rub that. Eventually I'll just bruise it and make it sore, and it's not going to let go. I need to get that out, and I can feel it here. You can feel how tight that is, right? That's all coming from in here, the tips of the toes. All that needs to be done properly. A thorough excavation. But should we do your neck?
Yeah.
Yeah. See if you guys got it done properly. Big breath. Just those ones. And in. And out. See? I'll let. How's that go? So again, I would come back and then I'd check him in for a couple hours on each foot. Because otherwise there's not much that we can do. You know? It's good to put all those joints in and everything, and then it comes down to, well, you won't get any more joints in because you've got them in. Let's excavate. Okay? And even,
That's around on the feet.
yeah, because if you look at his hands, they're not actually, I mean, there's still tightness here, but they're not as bad as his feet. You know, like he's sort of got reasonably, you know, sort of soft, the joints aren't too bad, thumb's a bit tight in here, so that's going to be causing a bit more problems coming up into here, you know. But he's not that bad compared to a lot of people up in his hands, yeah, except for there, right? But on this side, notice even that point's not too sore for you.
Yeah.
You know, it's like a lot of people are going to be real pain. It's really sore in there. It's a bit, but it's not. Even in here, not too bad, not too bad. You know, and you see his, you know, his fingers. They're not that bad. I wouldn't spend. You know, sure he's got. That's a bit stiff. You know. But I would tend to think the priority is definitely just look at his toes and you go, yeah, messed up. You know, curlings, you know, that quite strong sort of curlings up and in, yeah, and then the little toes are really hooking in under, like right in here. You see that? That's going to show a lot of upper little toe band tension, and right away you can see it's a bit sore for him even in here, right? So that's where the work is, and then I would come into his thumbs. Okay. So let's have a feel of this hand as well. Same thing, this one's a bit tight in here, you know. And that's going to manifest up through here in particular. But also then we've got a bit of inner wrist tension. So there is tension definitely in his hands. So that's why I would think, yeah, put all the joints in that are going to go in nice and easy at various stages of the treatment. But as we then want to get a deeper excavation, you know, a good couple hours here, a good couple hours here, a good hour and a half or an hour on each hand, and some face massage. And then we see how he's going. So, you know, easy, you know, and those will take at least 2 hours, yeah? I mean, if you can correct those feet in 2 hours, I think you're doing pretty well.
An hour a foot, not 2 per foot.
What's that?
No, an hour per foot rather than 2 hours on per foot.
I know, 2 hours probably on each big toe.
Wow, okay.
Maybe you'd get to that.
Wow.
Feel the joint on this one. That's like, feel how tight he is back here. That, you feel it, right?
Yes.
So that's messed up. That's going to take time to fix that. So yeah, no, I would say more than 2 hours on each foot. And you may as well just do, I mean, unless he can't handle it, in which case you would move around a lot. But I would suspect that's going to take some time to fix that.
But 2 hours, isn't it? You wouldn't do extra bits. You just focus on the thing.
I remember the first day.
Just so you can, otherwise you can get distracted. If you take on too much, like if I look at him as a project of how am I going to get him from where he is now to his ultimate state of no tightness, if I start moving from here up to here over here, it's sort of a disorganized approach that you could easily lose what the hell am I doing? Whereas if I go, let's loosen up one toe, you know, unless he's like, oh, that's too much, I've had enough, then at least I go, okay, I've done that pretty well. And I'll do the next one, and then I might come back and do another run over them until they're fully done. And then I've done it in an organized and efficient manner. Because otherwise, I think a lot of the way people approach massage tends to be a bit all over the place without an actual plan or strategy. And then they get a bit lost and not sure, and things never quite get done properly. It's like cleaning your house and going over to that corner and then over that corner. And you've done, and then over there, and then you forgot. You know what I mean? Instead of doing it in a systematic way. So yeah, I think a systematic way is better.
Should you adjust his toes? Crack them?
If they're going to go, sure, why not? There we go. So pulling of the big toe, under, and grip, not on the nail, and pull. Let's see that one. Like I said, that's so tight. That's not moving anywhere. Okay. So under, finger under, above the toe. That doesn't want to go either. So I'd have to loosen it up. Doesn't want to move. Good diagnosis, doesn't want to move either. So we got a lot, and I feel that, and I'm like, oh yeah, there's a lot of serious work there to be done in that toe. And if he leaves it, guess what? Probably arthritic, just gets worse as he ages. And this toe also, some pretty serious work in here. I mean, this is all super tight in here, you know? That's going to create tension coming up here, up into his belly, yeah? So, yeah, definitely, I would allow, I'd, you know, if it's his first treatment, I'd explain it to him. And I'd say, I'd be going, oh, you feel that? And he's like, yeah, fucking oath, I feel it, you know? So, oh, that's really tight coming in from here. And, you know, I'd want to do some real thorough excavation through here because it's all jammed up, even though we can't feel it. Once I get a chopstick in there, you'll feel how tight it is. That's holding that, it's holding that, holding that, and holding that. And that's going to then hold you right all the way up through here, into here, to here, and into here. And then it's going to get you in your chest and come right up into your throat. So I would explain it to him like that, yeah? Of course, it's up to him whether he wants it, you know? My job is just to educate him on what I see is the work needed. He's then got to go, yeah, that's right. Oh, thank you very much for finding my tension. I'd like to get rid of it. Let's work together to do that.
But people want it, but so many people aren't ready for it.
Well, oh yeah, a lot of people, because it's going to be a major transformation. A lot of people have security in fake personas or different things that they have, you know, that are associated with the tension, you know, with the thought virus. So they live in a fake life. They're comfortable in it until a midlife crisis or until death or something like that. And they're, oh shit, my life's a lie, you know? Better off cleaning it all out now. So yeah, some people aren't ready for it. They just rather live in their cocoon of bullshit. You know?
Yep.
So that's what I talked about here, something I don't know if I covered that as well in the last advanced course. We have the concept now of red light, yellow light, green light. I did, yeah. Okay, green light, I want to get better. Yellow light, I'm not quite sure.
Yeah, because I wasn't ready for you at the beginning of the week last year.
Yeah, you were yellow light. All right. So again, so much work. So again, it comes back to what I've shown you. So I know it might seem a bit repetitive, a bit boring, all this toe work and stuff, and a lot of people think it's got to be something more, but no, that's where it's, no, sorry. Fix the fucking feet, you know? And then the hands, you know, and 80% of people, 20% fix the hands and then the feet. And the rest will be easy. Okay? The joint adjustments, the other stuff's all the drama of the treatment. It's not actually what we're going for. We're not trying to get an exorcism with it, right? We're not trying to get him to scream out and have whatever. That might happen and it might not. What we're trying to do is get rid of all of this residual tension. That's something that physically we can feel. We don't know why he is tight, okay? I'm not claiming to be a psychic and go, oh, when you were 5, did this happen to you? Or in 5 lifetimes ago, did you get stabbed here and here and here? You know, that's not my role. Some people like to do that, and then maybe they do. Maybe they're real, maybe they're not. I'm not, my role is to go, you're tight here, 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 here. Should we get rid of it? His role is to go, yes or no. Or maybe. All right? Then his role is to pay me. Quite a lot, right? Because it's a lot of work. Yeah. So that's how it works. Yeah. Any questions? But that's how, again, you see I do a couple of adjustments, only take a few seconds, really, or, 10, 20 seconds. And they're, wow, powerful, and they do so much, but then you're back to, okay, what do we do now? Let's get some more tension all the way out of the feet and follow it up, or out of the hands and follow it up. So a lot of my work is just doing that, and it's doing this and doing that. And then, so you do all this boring stuff, it could be, from an out, I don't find it boring at all, personally. I find it fascinating to loosen this area. But from a lot of people might find it boring, right? To watch, to see all this. But you do that, and that you create then the looseness through which your adjustments can be done. Yeah? Whether they be the neck adjustments, whether they be the back. And you create this powerful transformation, and you create energy movements internally and all that kind of stuff that are very, very powerful. Right? So I know it's a different concept, it's different when what you guys, have been previously taught or previously even thought about massage, but I'm telling you, it's powerful shit. Powerful shit. Yeah?
Brandon, if
Yeah.
somebody's got a problem with their sacrum, so you'd have the person on the front and work on the sacrum.
I personally find it easier to work the feet mostly with the person facing up. So even though the big toe sacrum band is going to come here and eventually it comes there, I'd probably do most of the work on the big toe sacrum and then get them to roll over as we're doing that, and then do the side twist. But most of your work again is here. And then 70% is here. When I say 70% is here, I'm also then saying another 10 or so percent is here. And then another few percent is here. And then the other 10 or 15% is higher up. But I'm telling you, if you do this properly, the rest of it just melts in your hand. You just start touching it. Oh, that's like that. Oh, okay, there we go. It's gone. Maybe a bit longer than that, but not much. Because it's no longer anchored. But I can guarantee you start working up here, you haven't done that properly, you just hurt them. And it starts to be bad pain. It's just like, and you'll know it when you have somebody do it to you. And they don't do this properly, they're working on a spot, and you just go, that just fucking hurts after a while. And you can't force it to let go. You try and force things to let go, and they're anchored, you end up hurting them. Bad pain, bruising, soreness after the treatment, right? Most of the time people are sore in an area after a treatment where you've worked, but not let go. Think about that when somebody comes and says, I'm really sore in this spot. Because I've seen it so many times. I'm sore up here. Well, you probably went up here really hard, but it was still anchored here. And they're sore there. That's a bad sore. Okay? It's not a good sore. It's a bad sore because you didn't actually release it. Some people are sore after a treatment anyway. That's okay, but a lot of the time when it's higher up and they're sore after a treatment, that's because you didn't loosen the anchor points. I learned that a lot, okay? So these are mistakes I've made over many years. I'm not coming at you from a point of view of I haven't done the things that I'm telling you. I've done them, and that's why I learned not to do them, okay? I've made people sore. I'm like, I don't really want to do that. All right, so today, are you guys up to practicing some more on each other? I think you need to master the toes more and more and more and do what I was doing yesterday on Yasser a bit more. All right? So we don't need to even do a long treatment. Like let's try and do it maybe as an hour and a half, okay, before lunch. That's going to take us to 12:45. Can I get everybody's history forms again?